So pelvic floor muscle contraction, I guess you have to give that to a lot of your patients. How do they know if they're doing it right, basically?
Yeah, so with the pelvic floor contraction, ideally we get a squeeze, so from the back and the front, and also the lift. So we actually use both parts of the pelvic floor, or both layers of the pelvic floor. So the cue that sort of has been shown as giving the best evidence towards giving you continence control with things like a cough and a sneeze is actually more of a posterior cue, or a cue from the back. So what we want to think of is if the pelvis is slightly tilted sort of in standing, we want to be thinking about trying to pull from the back towards the front. So thinking about trying to close the anus and close the vagina, and then trying to lift up towards the pubic bone at the front. So the cue we often give is sort of imagining the opposite of a pebble falling into water. So if we have a pebble and we drop it into water, it then hits the water and the ripples spread out. So what we will tend to do is get people to think about trying to pull the ripples together to close the vagina and the anus, and then try and lift the pebble up and around towards the front of the pubic bone. So there's many other cues that we can use if you're struggling with that cue. You may feel a bit of a tightening through the front of the hips, through the lower abdominals, but what we don't want you to feel is a big brace or a big contraction through your upper abdominals, or a sensation of actually pushing down and opening through the vagina. So a lot of women don't know how to turn on their pelvic floor properly, and we may need to use lots of different cues. It's important to work breathing in with the pelvic floor contraction so that you're not holding your breath or bracing and pushing down. But if you're not sure whether you're doing the right contraction, we do recommend coming and getting it checked, because if you're doing lots of pelvic floor contractions either in pregnancy or post-delivery, or even just in your everyday life, we want to make sure that you're doing the right exercises, because if you are doing the wrong contraction, you can actually be stretching and weakening the pelvic floor.
Right. And if some women seek out using weights themselves, because there are a lot of products out there that can potentially help with pelvic floor muscle contraction, would you recommend that? Or
yeah, so in the right patient, yes, vaginal weights can be helpful to help strengthen the pelvic floor, or to give that feedback to make sure you're doing the right contraction. There are lots of sort of gadgets and things that we can use to give patients feedback. There's machines that can help read the strength of a contraction or the pressure change with a contraction, and also machines that can help stimulate the muscle if you're really weak or really struggling. But before we sort of suggest anyone uses any machines like electrical stimulation or biofeedback, or vaginal weights, we always suggest coming in to see a physio first, because it's not always that your pelvic floor is weak. Some women actually can't turn on their pelvic floor. So going back to the contraction that we worked on and thinking about trying to squeeze the ripples together and lift the pebble up, it's just as important to then feel the drop and then the release, and to let go of your contraction. So some women can turn on really well, but they can't turn off. And in those women, you sometimes develop more tension through the pelvic floor, which can sometimes cause pain. It can also cause incontinence and other issues. So it's really important, if you do have any concerns or you're not sure, that you do come and get checked so we can give you the right sort of mode of treatment.